Okay, so this is a model of a patient's right knee, and obviously the skin and muscle has been stripped away just to look at the bones and the ligaments. There are two ligaments on the side of the knee joint. The one on the inside part is called the medial collateral ligament. The one on the outside is the lateral collateral ligament. And there are two ligaments which cross on the inside. The anterior cruciate ligament is the one that goes from the front of the tibia or shin bone towards the back. And as you can see, when it's intact, it would prevent this bone from coming forward. But it's really important in terms of controlling rotation. And soccer players particularly need that ability to turn suddenly, to plant and change direction. So that's a very important structure. So when that structure is twisted and torqued to the point where it tears, we cannot go in and just sew it back together. It's like taking a piece of rope, pulling on that piece of rope. It'll actually unwind and then finally break. So we can't just take the two ends and sew them back together. So what we end up doing is to take a substitute, or a graft if you will, and actually drill holes in the tibia, the shin bone. This is done arthroscopically, and also a hole into what's called the femur. And if this were our graft, and in this particular case it's a tendon from the patella with bone plugs at both ends, we can actually take this tendon and bring it up through the tunnel in the tibia, and then place it back to where it normally should be, and we anchor it at both points with screws. And therefore we're actually reconstructing the ACL and not repairing the ACL. A repair would suggest we're just sewing the ends together, but we know from our experience in the past that that really won't hold up over time. So we're actually doing a reconstruction, and we use different types of materials. We can use grafts from your own body, or we can use grafts from what's called a cadaver. And there are various techniques to secure these grafts into the different anchoring points. But basically that's what an ACL reconstruction is all about.